Bismillah ar-Rahman ar-Rahim. Assalamu alaikum. So, I'm going to present you data on diabetic neuropathy and foot ulceration. Are they a risk for fasting during Ramadan? And I'd like to thank Mohammed for providing the data, and of course the investigators for generating the data. And it's one of the few studies where I've done the least amount of work. So keep coming. So this is the DAR Global Survey, a study that just keeps giving. In our data set that Mohammed gave to me, we had 11,060 patients with type 2 diabetes who fasted during Ramadan 2020 and 2022. The great majority, 74%, had no DPN, according to the records. 21.3% had DPN, and then 500 patients, 4.5%, had a diabetic foot ulcer. And that's the three major groups that we'll look at in relation to what happened during Ramadan. The origin of the patients, the biggest contribution was from Pakistan, India, then Southeast Asia, Middle East, Turkey, Gulf, and Maghreb. In terms of looking at how we interpret these results of what happened to these patients when they fasted, I think it is important to look at baseline in terms of their clinical and metabolic risk factors. So if you look at the patients in terms of whether or not they have no DPN, DPN, and DPN with DFU, what you see clearly is that those with DPN and DFU are older, they have a longer duration of diabetes, they also have higher HbA1c, higher BMI, well actually BMI is comparable, and higher systolic blood pressure. And so those are the risk factors that you'd expect in a patient with DPN, and particularly with DFU, which is consistent with what we would expect. Furthermore, when you look at these patients with DPN or diabetic foot ulcer, it's clear that they're not just occurring in isolation. They don't just have DPN. They're going to have other complications, and that could also influence the outcomes. And so therefore, they do, if you look, have more hypertension, more hyperlipidemia, more retinopathy, nephropathy, and of course they all have neuropathy and cardiovascular disease. So, no doubt, the patients with diabetic foot ulceration do have more complications. So what did they actually do? Did having these complications, having diabetic foot ulcer, prevent people from fasting? No. In essence, actually, yes, of course, more people without DPN fasted, 89.6%, but the great majority, 78% of people with DPN also fasted for the majority of Ramadan. The people with diabetic foot ulcer, however, did fast for a lesser duration, and that's because we'll come into those results, why they ended up fasting less. So if you overall look at the groups, the so-called control group, which is without diabetic neuropathy, neuropathy only, and diabetic foot with neuropathy, you can see that there is significantly less proportion of patients ended up fasting. Did they break their fast? If you have a foot ulcer, or if you have neuropathy, or you are at increased risk of breaking your fast? Yes. So, and this is significant, that patients with diabetic foot and neuropathy, they had a significantly greater number of days that they broke their fast. So on average, 10 days, neuropathy only, just over 2 days, and control group was about 1 day. Why? Well, predominantly because of hypoglycemia. So if you look at patients who had a foot ulcer, you can see that 1/3, 33.8%, had hypoglycemia, less so in those with DPN, and even less so with those without DPN. So more people with a diabetic foot ulcer were having hypoglycemia, and this was occurring, you can see, in all groups actually, predominantly between 3 p.m. and iftar, which is what you would expect. So, more patients with a foot ulcer experienced hypoglycemia, and more patients with a diabetic foot ulcer actually broke their fast due to hypoglycemia. So 92% of people who had hypoglycemia with a diabetic foot ulcer broke their fast, compared to, of course, those with DPN. So they were less likely to break their fast despite having hypoglycemia if you didn't have a complication, as opposed to having a diabetic foot ulcer. And also, more patients who had hypoglycemia were admitted to hospital because of hypoglycemia, 7.6% in the diabetic foot ulcer group, compared to 4.5% and 3.5% in the other groups. What actions were taken once they had hypoglycemia in the 3 different groups? Well, the majority actually, so that really over half stopped fasting if you had a diabetic foot ulcer. But interestingly, they actually really didn't do much else in terms of, I should say, actions taken. So, for example, stopped some of their meds? Not really, those with diabetic foot ulcer. Increased monitoring. In fact, actually, less people increased their monitoring if you had a diabetic foot ulcer. And I'll kind of try to explain that, because actually, if you'll look at the home blood glucose monitoring, those with the diabetic foot ulcer group were already monitoring quite a lot more than the other groups. The other component which we need to remember is hyperglycemia. So, again, those who had a diabetic foot ulcer, a greater percentage had hyperglycemia recorded, 39% as opposed to 23.5%, as opposed to 12.2%. And again, interestingly, during the fasting, hyperglycemia was predominant in the foot ulcer group, but during eating, actually, it was less, and I can't quite explain why that is. Maybe Muhammad can. So, as with hypoglycemia occurred more frequently in people with diabetic foot ulceration and also with neuropathy, but most in those with diabetic foot ulcers. More people broke their fast due to hypoglycemia, if they had hypoglycemia, 66.5%, as opposed to only 28.5% and 19.9%. But actually, admissions to hospital due to hypoglycemia were lowest in those with diabetic foot ulcer. Consequences in terms of what happened to these patients when they had hyperglycemia: stopped fasting, 58%, reduced food, not very many. It's something strange about these patients with diabetic foot ulcer. They don't seem to take action as to, to do something to try and, but maybe that's because actually they'd stopped fasting. So a large proportion, you can remember they fasted for 10 days less. So that's why they didn't make any changes. And again, increased monitoring. You can see 2.6% only increased their monitoring. And that's, again, I think this is reflected in the data by the fact that they stopped fasting. Now, in terms of SMBG during Ramadan, what is clear is that those with foot ulcer actually continued at the same frequency as before Ramadan. So they were already, I think, monitoring quite a lot, and they continued to do that. And so therefore, they didn't really make any changes. So they didn't increase the amount of SMBG, or nor did they reduce it. So they just carried on as they were. And I think that's just maybe part and parcel of the fact that they have a diabetic foot ulcer and they're being taught in clinics to make sure they're looking after their blood sugars. So that really didn't influence in terms of their ability to pick up hypoglycemia. And again, you can see SMBG was least the number of people with a diabetic foot ulcer were not undertaking SMBG. So they were regularly checking their blood sugars if you had a diabetic foot ulcer. And this is, 3 to 4 times daily in 28% as opposed to 10% or 12% in those without DPN and DPN. So overall, people with a foot ulcer were testing their blood sugars much more regularly. Is it perhaps the medication that they were taking that differed in the groups that led to more hypoglycemia or hyperglycemia? Well, if you look at the medication, actually what you see is overall, metformin clearly was the most kind of prescribed medication. And you can see that actually really no difference there. Sulfonylureas, least prescribed in those with a diabetic foot ulcer. And then DPP-4 actually again less. So TZDs, for some strange reason, about a quarter of people with diabetic foot ulcer were on a TZD. And SGLT2 at about 25%. But you can see diabetic patients with a foot ulcer, and I've not broken this down into once daily or basal bolus, but overall, when you combine the group, the majority of people with diabetic foot ulcer actually were on insulin. And that may explain partly the reason why there was more hypos. Finally, lack of education or education. What happened in terms of education in these patients, and did it influence what happened in terms of the outcomes? Well, if you look at diabetes Ramadan education, what you see is that in the categorization, there was a box that was ticked that yes, they received education. And actually, people with a foot ulcer, there was more, that is, they were apparently have more education. And this was during their clinic visit. The greatest number of people, proportion of people who underwent Ramadan education was people with diabetic foot ulceration. But I think really this is where maybe we need to look in more detail at the data. You can see the group sessions where I think really proper education is given was very low in the diabetic foot ulcer group. And so maybe when we say, oh yeah, 89% had education in clinic, they weren't really given it. So my conclusions are that the majority of patients fasted irrespective of whether they had or didn't have DPN or diabetic foot ulcer. There was an increased incidence of hypoglycemia and hyperglycemia in those with both DPN, but especially those with diabetic foot ulcer, despite them doing more home blood glucose monitoring. Hypoglycemia was a major reason for breaking the fast and also admission to hospital in those with diabetic foot ulceration. And maybe it was because more of those patients with DFU were on insulin or some form of insulin, about 80%. For DFU, a very low proportion of patients actually received group education. And as a result of that, I think that's why, when we say they had education in clinic, but they didn't really have proper education, that's why they didn't make the changes that we might have expected them to make in terms of their food or their medications. Thank you.